Welcome to our educational video on neoplasia. In this video, we will discuss about the clinical features of neoplasia, grading and staging of cancer, and laboratory diagnosis of cancer. First, we will discuss about the clinical features of neoplasia. It is explained through tumor-host interrelationship. It explains about the host response against the tumor and effect of the tumor on the host. What is host response against the tumor? Normally, body's immune system identifies tumor cells as non-self and works to destroy them, but some cancers trigger immune response which can lead to a better prognosis. In rare cases, cancers might even regress on their own due to this immune action. Then what is the effect of the tumor on the host? Tumors can influence your body, causing various health issues. Local effects causing compression, obstruction, tissue destruction, infraction, ulceration, and hemorrhage. Systemic effects like cancer cachexia, in which patients lose weight and muscle due to the tumor's metabolic demands. Fever of unexplained origin may be presenting feature in some malignancies. Tumor lysis syndrome, a condition causes extensive destruction of large number of rapidly proliferating tumor cells. Paraneoplastic syndrome. These are conditions caused by substances tumors produce or due to the immune response affecting various body systems far from the tumor itself. Next, we will discuss about grading and staging of cancer. Grading is defined as the gross and microscopic degree of differentiation of the tumor, while staging means extent of spread of the tumor within the patient. Thus, grading is histologic while staging is clinical. These are the two systems to predict behavior and guide therapy after a malignant tumor is detected. Let's understand grading first. Cancers are graded based on gross and microscopic features, with differentiation and growth rate being key factors. The Broders grading system is a widely used system for grading various malignant tumors. Borders grading is as under. In grade 1, well-differentiated cancers. In grade 2 and 3, moderately differentiated cancers. And in grade 4, poorly differentiated or anaplastic cancers are categorized. Next is staging. The extent of spread of cancers can be assessed by three ways: clinical examination, investigations, and pathologic examination of the tissue removed. Two important staging systems currently followed are TNM staging and AJC staging. TNM staging. It has three components, namely T, N, and M. T stands for primary tumor, and N stands for regional nodal involvement, and M stands for distant metastasis. These components are added with numbers to indicate the extent of involvement. The ACJ staging. The American Joint Committee staging divides all cancers into stage 0 to 4 and takes into account all the three components of the TNM staging system in each stage. The TNM staging and the AJC staging systems are commonly used for staging most malignant tumors. There are other staging techniques of staging. The non-invasive staging techniques, which is modern techniques like ET, MRI, and PET scans, and are used for non-invasive tumor staging. What are the advantages of PET scan? PET scans can distinguish between benign and malignant tumors based on biochemical and molecular processes. Now let's learn the laboratory diagnosis of cancer. These are the various methods of cancer diagnosis. The histologic method. The histological diagnosis of tumors relies on microscopic examination of fixed tissue with different fixation methods used for light and electron microscopy. Malignant tumors are distinguished by cellular atypia and potential for invasion and metastases, while benign tumors resemble normal tissue. The next method is cytological method. It involves exfoliative cytology and fine needle aspiration cytology. Exfoliative cytology, which examines cells shed from body cavities, while fine needle aspiration cytology, which uses fine needle to obtain cells from lesions. AFNAC, while highly reliable, should not replace clinical judgment or indicated histopathologic biopsies. Histochemistry and cytochemistry aid pathologists in identifying cell composition and products through staining, while immunohistochemistry is more useful for tumor diagnosis, while some of the common examples are given in the table. The immunohistochemistry method. It uses specific antibodies to identify cell components, aiding in tumor diagnosis. It is an immunological method for recognizing cells based on specific components in their membrane, cytoplasm, or nucleus. The process of immunohistochemistry involves antibodies bind to antigens, which are then visualized using fluorescent dyes or enzyme systems. Monoclonal antibodies are specific antibodies obtained through hybridoma technique, enhancing sensitivity and objectivity in tumor diagnosis. These are the antibody stains against intermediate filaments, aiding classifying poorly differentiated tumors. The next method is electron microscopy. The electron microscopy examination of tumor cells can confirm diagnoses made by light microscopy and immunohistochemistry. It reveals cell junctions, surface features, shape, nucleus, organelles, and secretory products, aiding in tumor diagnosis. The next method of diagnosis is tumor markers. Tumor markers are biochemical products of tumor cells, but their levels can be elevated in both cancerous and non-cancerous conditions. Therefore not suitable for primary cancer diagnosis, and they aid in prognosis and treatment monitoring. These are some of the important tumor markers. Let's learn some of the other methods in the diagnosis of cancers. Flow cytometry and in situ hybridization are modern diagnostic techniques used in tumor pathology. Flow cytometry analyzes individual cells for antigen identification and DNA content analysis, while in situ hybridization localizes nucleic acid sequences within intact cells. Molecular diagnostic techniques, including DNA RNA analysis, revolutionized tumor diagnosis and treatment. These techniques, such as DNA microarray analysis, enable the simultaneous measurement of thousands of gene expressions, aiding in diagnosis, prognosis prediction, and treatment planning. If you found this video helpful, please like, share, and subscribe.